Hello and welcome to Changing World. My name is Anthony Smith, and joining me today is a gentleman by the name of Dr. Deane Waldman. Dr. Waldman was originally educated at Yale University, followed by his training at Chicago Medical School, then later studying Pediatric Cardiology at Harvard. He became a renowned pediatric cardiologist for 37 years, up to his retirement in 2012. Dr. Waldman also studied systems theory, and since his retirement he has been applying systems thinking to find solutions to the failing US healthcare system. So, welcome Dr. Waldman. How are you today?
I'm excellent. Thank you, Anthony.
That's great. Well, I'm glad to hear it. Now, I've been reading through a few of your things that you've got on the internet and your website, and obviously your book is one of your major works, which I'm sure you're proud of. Now, in your book titled Curing the Cancer in US Healthcare, you talk about the truth and the lies. Now, could you explain that in more detail, exactly what you mean by that?
Yes, I have to say as a background statement that I started university here as a philosophy major, and after 2 years and actually enjoying it quite a bit, decided that I really wanted to study applied philosophy, also known as history, because philosophy and truth and falsehoods and so forth are nice constructs, intellectual constructs, but at the end of the day, what I want is things that affect people's lives, that help people. That's kind of what a physician does. And so I would rather talk about, rather than truth and falsehood, what works and what doesn't work.
Right.
And I'll give you a great example, and that is people tend to say, for example, that they want an efficient doctor. Well, actually, they don't. They want an effective doctor. What I mean by that is this. If you think about what efficiency is the optimal use of resources.
Okay.
Effectiveness means you're going to use the resources, however you use them, hopefully efficiently, but to achieve the specific effect that you want. And so that distinction is a little like truth or falsehood, which is what works is what I care about, what I would call the truth. And I'd rather use falsehood than outright lie. A falsehood is something that doesn't achieve the outcome, the effect that you want. And when we get to healthcare is a great example. The fact is we're talking all the time about the insurance rate.
Okay.
Here in the United States. This is different than, of course, than in Great Britain.
Right, yeah.
When you talk about the number of people insured, there is an assumption there that insurance leads to care, and timely care at that. However, at least in this country, that assumption is false. Right. And so what happens is there are many people, millions of people, who have insurance and can't get care on time, and there are people who don't have insurance who do get care on time. And my point for that is, and we'll get to how the system doesn't work here and so forth, but the systems theory. But the issue that I want to answer your question is that the assumption is false. The assumption is incorrect. And so we need to go back and say, what is it we really want to accomplish with a healthcare system? Do we want to save money? Is that the primary goal? Do we want to insure people? Is that the primary goal? And the answer to both of those questions is hell no. What we want to do is get care to those people who need care when they need it.
Sure. Obviously, the point you're making there is time is also an important factor.
You bet.
Because as time goes by, obviously illnesses can get worse, can't they? So,
well, the lawyers say, what is it? Justice delayed is justice denied.
Right.
You've heard that phrase. I like the phrase, healthcare delayed is no healthcare at all.
Okay.
Because there are reports in this country, which I hope you're not aware of, because it's so depressing, but there are reports in this country of our veterans in our Veterans Administration System. The latest report shows at least 47,000 veterans died waiting in line for care.
Really? Well, I'm really surprised to hear that. I had no idea myself.
This is an internal report from the VA itself, and it when I read this thing, it frankly made me crazy. It made me so angry to say these people put their lives on the line and were injured. Yeah. And what do we do for them? We put them in a line, and we don't provide the care. So our system, there are other examples, but that's the most dramatic I know of. So bottom line is, to a long-winded answer to your question, we need to talk about what is effective in getting care to our people, and then we can talk about money, and then we can talk about insurance rate, but we have to start with, will it deliver care or won't it?
Right. That's obviously a good point. And a lot of it, as you say, depends on kind of logistics, on being able to deliver the solution at the right time.
That is certainly true.
Yeah. Which I'm sure you've obviously put a lot of thinking into this and written the book about it. Now, I had a second question here, which probably leads on to from what we just talked about. Because in the book you make a statement that millions of Americans are wasting money on standard health insurance. Now, could you explain why you believe that's the case, and also justify what alternatives there are? What choice do they have in the matter?
Sure. Okay. That's actually a three-part answer. I'll start with this. The word insurance in every other context except healthcare means protection against financial disaster. If you buy auto insurance, and you get into a crash, what they do is they give you money so you can replace your car. You'll also presumably pay some of your medical bills. If you have a homeowner's insurance and there's a disaster, a hurricane, a flood, and so forth, you're buying insurance against the financial loss that you're going to incur as a result of whatever happens.
Yep.
In healthcare has become, in this country, a prepayment scheme where for a limited input, you have an unlimited output. And when you think about it, just as an economist, I went and actually got an MBA because I wanted to be a better I was the chief of cardiology at the University of Chicago, and I didn't understand all these financial things and that they would throw at me, and I wasn't trained that way. So I went and got an MBA, and then I began to understand the economics, where the money flows, which leads me to the second part of my answer to your question. I said that millions of Americans are wasting billions, and I mean literally billions of dollars, on health insurance. Okay. In 2018, which is the latest data we have, the average American family paid, ready for this, $28,166 for healthcare costs, the vast majority of which went to insurance premiums. Now, that represented about a third of the gross income of that same average American family. So that's more than their mortgage. That was the number one cost item on their budget, $28,000 that went to the insurance company. Now, I look at that and say, well, wait a minute. The healthy family that, the child had a cold, or, the father fell down while skiing and broke his leg. These are not trivial, but they're not life and death. They're not $250,000 outlays.
Right.
What if, instead of paying all that money to the insurance company, they paid that money into an HSA and simply bought catastrophic insurance, high deductible catastrophic insurance, and otherwise they just shopped for their care? Okay? So, you asked me what you're going to ask me, or you did, what the alternative is for this family. I turn around and say, don't give your money to the insurance company. Give your money to yourself, put it in an HSA, and simply buy, $10,000 high deductible catastrophic insurance, so that, God forbid, there's an automobile accident or a heart attack or you get cancer. Fine, you're covered for that. But for everything else, you can pay out of your pocket. And when you look at we have here, actually you do too, you have Harley Street and equivalents, but we have here private entities that don't take insurance. Okay? If you look at them, which I did, and it's in the book, Curing the Cancer in U.S. Healthcare, very important, small item, but very important. If you look at the comparison chart of the cost to the consumer, of, say, a hernia repair or even a knee replacement or a hip replacement, and you compare the costs for the cash only to the cost of the insurance-based system, you'll find that it's between 20 and 40%. That is, like a third to a quarter the cost that you see for hip replacement. I'll give you an example. Hip replacement in this country, insurance cost is $35,000 and some odd dollars. That's the charge.
Yeah.
Okay. So I look and I say, hernia repair. Hernia repair was something like $15,000 insurance and $1,500 or $1,700 for. So you can pay that out of your HSA, no problem.
Mm-hmm.
So that's I'm trying to get the doctor and the patient reconnected directly without a third party in between. That's what is the solution, at least in this country, for our healthcare nightmare.
Right. Okay. Well, that's that's quite a radical point of view, and I'm sure it would be the subject of debate among politicians, wouldn't it?
Well, all right. No, I would argue it won't be any debate. They will all, doesn't matter about the party, they will all hate it, because basically what I'm doing is taking power away from them and their bureaucracy and giving it to the people. Let them control their own money. Let them control their own lives.
Yes,
it sounds practical, but let me say one other thing, and that is, I come from a medical family. Literally, we had a family reunion a couple of years ago up in Colorado at one of my uncle's houses. There were 17 of us who were all uncles, cousins, my grandfather, my father, were all physicians. Why am I saying this? Because I remember when I was a very little boy, with my grandfather lived under that system, namely the patient paid the doctor, the doctor took care of the patient, and there was no third party in between. There was some insurance for lost wages and things like that, but it was direct doctor to patient, and that is what is so attractive to us as physicians. We would like to get the third party out of the interaction with the patient, so that I don't have to fight with an insurance company to get what my patient needs. Yeah,
exactly. Well, it did that point you've just touched on. I actually have a question written down relating to that very point, because I'm going to read this out right now. You indicate that the present healthcare system is bogged down by too much bureaucracy. Now, how can we fix that? Obviously, what you've just said is very radical. Is there any middle ground, or does it require something as radical as what you just stated?
Okay, very interesting answer to that, which is yes and no. What I mean by that is multi-part answer. What I mean by that is, number one, the federal bureaucracy consumes, both directly and indirectly, over 40% of all U.S. healthcare spending. So that's over $1 trillion of patient care that patients don't get, Americans don't get, because the money goes to bureaucrats instead of nurses and therapists and hospitals and doctors. And okay, fine. So my first statement in answer to you, how do we get rid of the bureaucracy, is we get Washington out of the equation. What does that mean? What that means is we let the people in their states decide what kind of health care they want. Now, I'll give you two great examples, the two biggest states. One, California claims to want single-payer system. Okay, my response is, fine, get the federal government out of healthcare and let California construct it. I mean, California has 2 million more people in one state than all of Canada.
Really?
Well, if Canada is allowed to have its own healthcare system, and as you know, the provinces in Canada actually, to a large degree, control the allocation of their resources within that province, Ottawa versus Saskatchewan. Quebec certainly is different than Saskatchewan. I say, fine, California wants single payer. Let's get rid of that bureaucratic cost from the feds and let California have its own single payer system. If it works for them, great. If it doesn't work for them, that's on them. Meanwhile, Texas will want a market-based system, kind of what I suggested before, which is that the patient controls his own money, with a safety net for the truly vulnerable, disabled and blind and so forth. But if Texas wants that, fine. They still get rid of all that massive bureaucratic cost from Washington, and they construct their own system. And at the end of the day, if a group of our states, say all the Northeast states, Vermont, New Hampshire, New York, Connecticut, want to create a consortium and they want Obamacare, and they like Obamacare, fine. Let them do that and not have to pay all that money to the feds. I'm with all of this as long as the people decide what they want, instead of having Washington say one size fits all, and because we know that A, one size does not fit all, and B, they're stealing $1 trillion of healthcare money.
Right. Well, it sounds like an awful lot of money, going to waste, or not obviously being channeled into where it could be channeled into.
The patient care.
Yeah.
Exactly.
Yeah.
Yes.
Yeah. And
so when I look at these numbers, the 28,000 from a family, or the $1 trillion for the federal bureaucracy, I keep saying this is ineffective use of an individual's or a nation's money, and we need to make that money go to the effect we want, and the effect we want is timely care.
Yeah. So could you just explain, for the benefit of anyone listening, why is it that different states appear to demand different types of implementation?
Okay. All right. The answer is a two-part answer to that. Number one, a lot of this is media and political bias, so that California will want one thing because it's very hard to the left of our political spectrum, and Texas will want another thing on the surface. Now, the question is, to heck with the politicians and even to heck with the media. I want to know what the people in California want, as long as they understand what they're getting, the consequences of what they're getting. Yeah. Same thing for Texas or whatever. Now, I'll give you an example of why one size fits all just plain doesn't work for our country. You understand that this country has 327 million people spread out over 3.8 million square miles. Okay? In Great Britain, everybody is close to everybody else. It's so much smaller in the sense of concentration, so that, for example, Rhode Island and Montana have the exact same population, 1.1 million people in both of those states. In Rhode Island, there are 5,500 doctors in 1,200 square miles. Right. Okay? In Montana, there are 1,100 doctors spread out of 145,000 square miles. Right. Now, anybody who thinks that you should have the same healthcare structure and delivery system in those two places is absolutely out of his mind. Yeah. They need different processes. They need different structure. You can get in Rhode Island, in Providence, Rhode Island, you can be in Boston with 3 world-class medical centers in less than an hour, and the nearest major medical center to the capital of Montana is Salt Lake City. That's 8.5 hours by driving, assuming you can actually have a passable road. So my whole point is that different areas have different needs, different resources, and need a different structure.
Yeah, that certainly makes sense. And again, it comes down, it seems to me, it comes down to logistics, doesn't it? How you can deliver the healthcare when faced with a different set of logistics and
how to pay for it.
Yeah, which is an important point. Which again, it comes down to, I suppose, what people are going to want in that particular district, what they would be happy with.
It's their money, Anthony. Yeah. At the end of the day, this is just as true in your country as in mine. Yeah. At the end of the day, the government has no money. The government spends our money supposedly on our behalf. And I'm sorry to say, at least in this country, our government, both parties. This is not a Republican or Democrat talking. My personal party, by the way, is the JPD party, which is just plain disgusted. And a lot of people belong to my party. Anyway, the point is that we need to get the federal government out from controlling healthcare, and we need to begin controlling it ourselves. That's what the cure, the title of the book, Curing the Cancer in U.S. Healthcare, is the cancer is the federal bureaucracy, and the cure is to excise it, to remove it, to return the power to we the people.
Right. Well, as I said before, it sounds radical, but if it can be made to work, then that may well be the solution. I
have to end with one other thing, which is this. Does it sound radical? Well, if you're old enough, like me, no, it is not radical. It's exactly the way my grandfather practiced medicine. But I would say, okay, I'll give you radical. I'll give you the fact that this is really a surprise, and I'll even give you the word radical. As a physician, if you have a patient who has an upper respiratory illness, you treat him in a careful manner. You find out what the infection is, where it is located, and things of that sort, and you take care of the patient as quickly as he became sick.
Okay.
So if it took you 2 weeks to get sick, I would expect to try and get you better in 2 to 4 weeks after that.
Right.
If a patient comes bleeding to death after an automobile accident, you have to do everything instantly.
Yeah.
No, in other words, what I'm trying to say, it's a principle of medicine, which is the sicker the patient, the faster you have to address the problems that he or she has and deal with them. And therefore, since our healthcare system is so sick, and I mean critically ill, we are bleeding money, our patients cannot get care, and if you look at any poll in this country, you will find the number one issue in people's minds, more than immigration, foreign policy, education, very important things. More important than any of those in people's minds is our failing healthcare system. So, for me, what I am proposing as radical is, in fact, practicing good medicine on patient healthcare.
Well, that's, very well said. I mean, I can't argue with that. And, if it can be made to work, then that's great. I mean, I'm just thinking realistically, how difficult could it be to make such a change throughout the United States? How difficult would that be, in reality?
All right. The reality is that it would be, I'm sorry to say, very simple but hard. And the reason it would be hard, as in difficult, is two things. One, we would have to have a groundswell of people to force our federal politicians to do this. They don't want to give up control of healthcare. That's for damn sure. So we need a groundswell of literally millions of Americans to say, we want to take back control of healthcare. I think we could actually accomplish that. The second part, however, is there are all these stakeholders, some of whom would lose billions of dollars. Now, for example, the insurance companies would almost certainly be big losers in my approach. Would the doctors lose? No, the doctors would make more money. Would the hospitals lose? No, the hospitals will actually make more money more quickly than what they're doing now. The average review process is 22 months before if you deliver the service today in an insurance-based structure, you're going to get paid a minimum of 22 months from the time of point of service. Time value of money, that is a real loss. In addition to uncompensated care would go away, so that's a great advantage to the American patient. But there are a number of stakeholders that would be losers, starting with probably 1 million, well, more than that, bureaucrats.
Right.
Okay, well,
Yeah.
I got news for you. I don't want to keep paying a federal bureaucrat's salary. I'd rather take that money and give it to a doctor or a nurse or a therapist. And that's really, when you put it that way, when I put it that way, to an American, they go, yeah, of course. Well, then you need to regain control of your money. And yes, it will be difficult because all the politicians will get together and say, oh, no, you can't do this. There won't be care and people will die in the streets and this will be just terrible. Well, no, it won't. As a matter of fact, you mentioned about, well, how hard is this? In the book, Curing the Cancer in U.S. Healthcare, I actually have financial models that show how this would work to the benefit of the American people. I didn't say to the bureaucracy. The bureaucracy will be the big loser. But as far as I'm concerned, that's good medicine. That is effective healthcare, not ineffective healthcare.
Right. Okay. Well, you've certainly made your point today, and it's certainly been a pleasure talking to you today. So I'd like to say thank you to Dr. Deane Waldman for being with us today, and thank you to everybody who's actually listened to the podcast. And we're going to actually put a link below the video so that if you like to find out more about Dr. Deane Waldman, there will be a link to his website, and you can actually log on to his website and download some free information. So yes. Once again, Dr. Waldman, thank you very much, and I hope that message goes out to people and it makes people really think about, what they might be able to achieve if they, come together and try to make a difference.
Thank you. Yes.
Right. Well, that's about it. So thank you to everybody for listening in, and we'll speak to you again. Thank you.